My name is Anika Venkatesh, and I'm excited to present Ending Period Poverty, period. First, a little bit about me. I'm a rising sophomore at Los Altos High School in California, USA. I'm a passionate dancer and learn both classical and modern Indian dance forms. I'm also the co-founder and co-president of the Medical Lab, which is a club at school where we do medical case studies, discussions, and labs, and we explore different careers in medicine. I'm the president of Los Altos High School's Girl Up chapter. Girl Up is a UN organization that advocates for gender equality. I'm a teaching assistant for Kathak, Bollywood, and my native language, Tamil. Additionally, I am on my school's varsity public forum debate team. I'm interested in doing medical research, and I am looking at a career as a physician. I also plan to continue to raise awareness about gender equality and plan to continue to learn and perform dance. Let's start with what period poverty is. Period poverty is a global issue where many women do not have the resources to buy menstrual hygiene tools, do not have access to the proper amenities, and are not properly educated on menstrual health and hygiene. Period poverty has two main causes, the first of which is the stigma that surrounds periods, more specifically as a part of cultural narratives. This has caused the lack of facilities as well as a deficiency of education about periods. Second, the pink tax raises the price of products targeted towards women, making them almost unaffordable. In many cases, this also extends to period products, where there's an additional tax because they are tagged as luxury. I became interested in this topic as a part of a project done on the UN's 17 Sustainable Development Goals, and since then, I've done research, presented about the topic, and held donation drives. This topic continues to be a focus for me, and today I'm going to be presenting about what I've learned. We're going to look at the data, understand the immediate and long-term effects, look at the cultural stigmas, and see how you can create a positive impact. The first graph about access to period products is from my research. I gathered data about whether or not middle school students have seen period products in female bathrooms, and only about half the girls said they've ever seen period products in female bathrooms. However, this still wasn't that they consistently saw these products. Moving on to the data about health education, in Bangladesh, 2/3 of girls are unaware of what periods are before they actually get their period. In Kenya, 70% of girls have had their grades in school impacted due to their period, whether it was because they missed school or couldn't do their schoolwork. We continue to see the stigma in the next chart as 60% of Kenyan girls are embarrassed about discussing their period. Let's talk about the immediate effects of period poverty. One of the most pressing effects of period poverty is that girls' education is disrupted. Every year, 23 million girls in India drop out of school due to their period, and this essentially shows how education is completely stopped for many girls because they are unable to take care of their period and school. Additionally, period poverty poses a health risk for many women. Improper hygiene and limited access to the appropriate products can result in infections and physical pain, which can also cause problems like infertility. Additionally, a girl's first period is seen as a sign in many cultures that the girl has come of age, and in many rural communities, a girl is married off right after her first period. Due to the fact that they do not have the proper products, the risk of STDs and early pregnancy increases. Another major impact is that a lack of dignity causes mental health issues due to the stigma that causes social isolation out of cultural practices. One of the most dire effects is that women have to choose between needs like food and access to hygiene products because this forces women to make hard decisions about what life essential they need. This is one of the true factors that perpetuates period poverty. Cultural stigmas and stereotypes dictate how women are treated on their period, and in some cultures, menstruating women are treated as if they are unclean or impure. Cultural narratives also state that periods should not be openly discussed, and it has made periods a shameful topic. Additionally, stigmas don't support women buying period products openly. In rural communities in India, women are given the products wrapped in a newspaper or opaque black bag. Further, globally, advertisements that actually openly advertise period products are focused on concealing the flow and odor. One of the most damaging practices is in global rural communities, women are isolated while they are on their period. Though this practice is illegal in Nepal, it still happens. It became illegal due to the danger. It is both unsanitary and unsafe and has been fatal. Period poverty has many long-term impacts. First, girls' education and career opportunities will be impacted. Period poverty forces girls to miss school and or drop out because of their period. And if this continues, there will be more girls who don't get a proper education or career. Next, birth rates will drop over the next few generations. Due to the health issues that period poverty causes, it becomes harder for women to actually have children, causing a steep drop in birth rate. Further, continuing stigma and an ongoing negative social narrative impacts the access to health education for young girls, and it will become harder. The goal of gender equality will also get pushed out due to the continuing mindset that period products are a luxury or at least not a priority. This also translates to lawmaking, where period poverty will not get enough public policy focus. This limits the potential for future solutions and perpetuates the problem. Finally, the worst impact is that period poverty will become normalized. Now that I've talked about the problem, let's talk about the solutions. One way to help is to donate. These donations can be monetary or period product donations. Here, some examples of places to donate include the PAD Project and local homeless shelters. Aside from donations, there are so many organizations that do advocacy work, and two of them are Girl Up and Period. Additionally, on social media, you can be a part of Period Poverty Awareness Week. Other ways to be involved include holding donation drives and helping educate families and children. The best way you can be more educated about the issue and to destigmatize the issue is to utilize the media and encourage others to do the same. You can watch movies and documentaries such as Period, End of Sentence on Netflix, which talks about period poverty in India. You can listen to podcasts, read books like It's About Bloody Time, Period, by Emma Barnett. You can read writing or research like the NIH's collection on period poverty and watch PSAs. Period poverty is a critical priority. Its impacts include limited access to education and compromised physical health. If this continues, worldwide gender equality will be less achievable. Advocacy can be done in the form of donations and using the media to stay informed and educate others. For this change to be realistic, it has to affect the stigmas as well as the public policy that supports the stigmas. These are my references. I'd like to say thank you to the Global Health Leaders Conference and Johns Hopkins University for giving me the opportunity to present. I'd also like to thank Bullitt Charter School, my middle school, for inspiring me and providing me the resources to do research on this issue. I'd like to thank Los Altos High School's Girl Up chapter for providing me the opportunity to continue this initiative, and I would like to thank my family and friends for always supporting me. Finally, I would like to say thank you to all of you for listening to my presentation today. Here's my contact information. Feel free to reach out to me if you have any questions or want to get in touch. Thank you so much.